All right, so muscles of the pectoral girdle and upper limbs. Again, as mentioned earlier, pectoral girdle refers to shoulder. The anatomical region, or this anatomical region, includes muscles associated with the pectoral girdle, the scapula and clavicle, the arm, which is the humerus bone, the forearm, the radius and ulna, and the hands, all of those associated bones. Muscles that move the scapula are the serratus anterior, the pectoralis minor, the trapezius muscle, the levator scapulae, the rhomboid major, and the rhomboid minor. And here those are, there's the pectoralis major. You may have heard bodybuilders refer to their pecs, that's the muscles of the chest. There's the deltoid muscle, both of those attached on clavicle. You have the pectoralis minor, the serratus anterior, all of those coming in and attaching to the acromion process of the shoulder blade. Again, here's the muscles on the back. There's the trapezius muscle, goes up and attaches into the vertebral column in the back of the skull on the occipital bone. There's the deltoid muscle again going across the shoulder, the latissimus dorsi. That's the muscles again on the bodybuilders that give them the big V-shaped back. That's sometimes called the lats muscles. Here you have the levator scapulae. Scapulae refers to the scapula. Levator lifts, elevates. Rhomboid minor, rhomboid major, and there's the scapula and all the muscles attached to the scapula. Again, the table showing the origin, insertions, and the principal action. Again, not going to be overly concerned about the nerve insertion for these. I want you to be aware. Again, when you see this big long list, as I've said in the first bunch of these muscle videos, don't panic when you see the numbers. You will be receiving a list of about 30 to 35 muscles that I want you to know the origin, insertion, and actions of. You can watch these videos on your own. I'm not going to take time to go through them here. So the muscles of the shoulder and arm, but again, these little short videos show the muscles, their attachments, and what part of the body they move and how they move it. The muscles of the shoulder and arm, the muscles that move the humerus, the pectoralis major, the latissimus dorsi, the teres major, the coracobrachialis, the teres minor, the supraspinatus, the infraspinatus, and the subscapularis. The last four of these, teres major, teres minor, supraspinatus, infraspinatus, and subscapularis, are what is referred to as the rotator cuff. Told you earlier in the semester that I had rotator cuff surgery a couple of summers ago. I do not remember if my surgeon told me exactly which one of these I had a problem with, but I know one of them, he had to repair two of them actually. One of them needed to be reattached, and the other one he enhanced the attachment. But one of those tendons was completely loose. The other one was stretched, and he just sort of fortified the attachment on that. Muscles that move the forearm at the elbow, the biceps brachii, the brachialis, and the brachioradialis. The muscles that flex the elbow, the triceps brachii, and the aconius, which extends the elbow. Again, there's the shoulder, the collarbone, showing the deltoid muscle, pectoralis major muscle. There's the coracobrachialis muscle, it's the small one underneath there. There's the biceps brachii. Biceps literally means two heads. So there's the long head and the short head. There's the brachioradialis on either side. Excuse me, the brachialis, and the brachioradialis is the muscle that runs right down this part of the forearm. This is the forward view, the backward view. Here's the spine of the scapula with all its attachments. There's the deltoid muscle again, the rotator cuff, the supraspinatus there, the infraspinatus there, the teres minor and teres major. Generally, the rotator cuff problem is not with the muscles themselves, but with the tendons that insert on the clavicle and on the head of the humerus. Again, same chart. Again, don't panic about the numbers. You will get a list of about 30 to 35 muscles that I will expect you to know. A couple more videos that you can watch at your leisure. The rotator cuff group, small muscles with relatively minor actions. Together they hold the shoulder joint during forceful movements that could damage the joint and dislocate the humerus. Most important to forceful overhead arm movements like throwing a baseball. Trauma to the shoulder can also damage muscles and tendons. Individuals over 40, especially if they exercise intensely, are more at risk. You may wonder, those of you who, like for instance, I have daughters, and a couple of my daughters, my two older girls, wanted to play softball because I was a baseball player, so they wanted to, be like Dad and play softball. But tragically, technically, they are not my daughters. They are my wife's nieces, but we raised both of them. And so they wanted to be like me. They wanted to be baseball players, or softball players. But unfortunately, since they had none of my genetics, they had my wife's family's genetics, and no disrespect to my wife's family, but those people are not very athletic, none of them. Great artists in my wife's family, but not the best of athletes. So my two older girls had absolutely no hand-eye coordination. A ball of any kind, baseball, basketball, softball, volleyball, coming toward them usually resulted in it hitting them, not being deflected or caught or whatever. So they weren't able to play softball. But one of the things that always interested me when I first started watching women's softball and girls softball is boys in Little League are allowed to pitch. Generally, in most leagues, they will let a boy pitch a baseball game once a week, and then he cannot pitch anymore that week. Girls, on the other hand, especially when they get a little older, 13, 14, 15 years old, and start playing in these traveling leagues, these girls might pitch, sometimes two games a day. And I always wondered, why is it that boys are not allowed to pitch but once a week, but girls can pitch every day, and again, sometimes during tournaments, twice a day? And the reason is because of the muscle group, the rotator cuff muscles, that let your arm do this versus the muscles that let your arm do this. This is a much more natural motion. When you do this, there's not a lot of strain on the muscles of the arm and shoulder, because when you're pitching a ball this way, most of the stress is on the large muscle groups in your back and chest, not a lot up here. When you're doing this, you're putting huge amounts of strain on these smaller muscles up here. So that's why, if you have Little League baseball and boys are only allowed to pitch one game a week, or, you have to wait 72 hours between games or something. But girls can pitch every day, pitching the fast pitch softball. And again, I can tell you right now, there are other pitches that baseball pitchers throw that are much more harmful to the shoulder than a fastball. A curveball, for instance, throwing a curveball properly puts much more strain on your shoulder and elbow than throwing a fastball does. Injuries vary widely in severity, from local inflammation that reverses itself with rest and anti-inflammatory medications to acute muscle and tendon tears that require surgery. Symptoms of acute tear are immediate pain and loss of movement. Less serious conditions, weakness, comfort, limited range of motion, may not be aware of the injury until the arm is raised. My surgeon told me that most men in my age group discover that they have a rotator cuff injury when they start having trouble getting their wallet out of their pocket. I know that sounds kind of funny, but that movement right there, these muscles are all involved in. If you have irritation up there, that gets irritating. And moving your arm, one of the physical therapies they did was to put my arm behind my head, behind my back, and lift my hand up toward my head. Try that sometime. With a good shoulder, it can be uncomfortable. Think about a shoulder that was just recently repaired by surgery. Prevention involves targeted exercise to strengthen the muscles, tendons, and insertions without pushing them to the point of damage. After the injury, gentle exercise serves as physical therapy. One of the things you will oftentimes see, again, I always go back to baseball. I was a baseball player. And one of the things you will see occasionally when you watch a game on TV is you will see a baseball player, always going to be a pitcher usually, and he'll be on the bench and he'll have like a rubber band in his hand and he's going like this. He is working to strengthen those muscles in that area to prevent, rotator cuff damage. One of the most common questions I hear here is difference between rotator cuff surgery, and again, people who follow baseball have always heard about players having Tommy John surgery. Rotator cuff is shoulder, Tommy John surgery is elbow. They're replacing ligaments in the elbow. And generally in a true Tommy John surgery, they're actually taking a ligament out of some other place in your body, oftentimes from this arm, if you're right-handed, from this arm and putting it into this arm. Again, there is the muscles of the arm, forearm, and hand. Muscles of the arm, okay, there. This is improperly labeled, but there's the muscles, the biceps brachii, radialis. Muscles of the arm, forearm, and hand are muscles that appear in layers. So when you start looking at pictures of these, some muscles lie underneath other muscles, so you have to cut and reflect those muscles out of the way to see them. They can be arranged by origin, anterior or posterior forearm, actions, and where they insert. The wrist flexors of the anterior forearm, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. Finger and thumb flexors, the flexor digitorum superficialis. Okay, flexor, it flexes. Digitorum, digit, fingers. Superficialis, the one on the top. Flexor digitallum profundus, again, flexor digitorum profundus, going to be the most prominent one, the one that shows up most easily. And then the flexor pollicis longus, it's going to be a very long muscle. The forearm pronators, the pronator teres and the pronator quadratus, and the supinator is the forearm supinator, and there's all of those muscles. Again, superior transverse ligament of the palm, that's all of those ligaments you feel in your palm. There's the aponeuroses of the palm, flexor digitorum superficialis, that muscle right there, palmaris longus, right there. Again, that's the flexor. The flexor digitorum superficialis is on the top. Extensor carpi radialis, flexor carpi radialis. Pronator teres is there. Then this is looking at the hand this way. Then this one is looking at the hand this way, or the arm and hand. This, in other words, this is the underside of the arm. This is the outside of the top of the arm. There's the flexor reticulum, the tendon for the flexor digitorum superficialis muscles, the tendons of the pollicis longus muscles, pronator quadralis muscle, tendon of flexor carpi radialis. There's the flexor digitorum superficialis. There's the supinator muscle. There's the extensor carpi radialis muscle. And then you have the tendon of the flexor pollicis longus muscle. Again, those tendons of the flexor digitorum profundus. And if you follow that tendon back down the muscle, flexor digitorum profundus, you see very topmost muscle, very longest. Again, I don't see the superficialis. The wrist extensors and posterior of the lateral forearm. Again, the extensor carpi radialis longus extends. Carpi radialis longus, extensor carpi radialis brevis. In other words, this is a long muscle. This is a short muscle. Extensor carpi ulnaris probably connects to the ulna. Again, look at some of these names and see if you can figure them out. Extensors of the fingers and thumb. Extensor digitorum extends the digit. Extensor indicius. Extensor digitorum minimi. Extensor pollicis longus. And extensor pollicis brevis. And again, there are those muscles. You see their attachment on the ulna. And over here, again, the underside of the hand, superficial view of the hand, the superficial muscles. All the superficial muscles have been removed, deflected, and to give us the deep muscles. Again, showing the chart of the muscles, and again, just emphasize, when you see this major list, do not panic. We will, again, I will be giving you a list. A couple of more videos that you can watch as you have some time. The hand muscles that move the thumb and finger, you have the abductor pollicis brevis, the lubricals, the palmar interossei, and the dorsal interossei. Again, there are these muscles. All kinds of muscles of the hand. Again, you could spend a week just trying to learn all of the muscles of the hand. That's why this is one of the reasons that if you hurt your hand or injure your hand, many times you will be sent to a hand specialist. Yes, there are orthopedic surgeons out there, but many times a hand is so intricate, you would go to a hand specialist. Again, showing some of those more deep muscles, the lubricals, palmar interossei, and the dorsal interossei. Remember, this is showing the palm of the hand here. This is showing the back of the hand there. All right. We will pick up with, after these videos, with muscles of the hip and limb. I will start this one in just a moment. So I'm going to get a drink, rest my throat for a little while, and then I'll be back.